Thank you, Madam Speaker. I rise for a point of personal privilege.
Delegate Head, you have the floor.
Thank you, Madam Speaker. I rise today to talk about foresight. Now, if the weather forecast is to be believed, a few days from now, there are going to be several inches of snow on the ground in much of our Commonwealth. Now, the amount of analysis and hard work that it takes to accurately predict the weather is amazing. It takes years of training and sophisticated computer models and sometimes just dumb luck. But not every forecast is that complicated, Madam Speaker. Now, I'm no Nostradamus, but I can say with almost complete certainty that the sun will rise tomorrow. There are some things that follow a predictable pattern, so we can plan for them. And that, Madam Speaker, is why I cannot fathom why the Commonwealth of Virginia was not ready for the rollout of the COVID-19 vaccine. We've known since last year that a vaccine was likely to come and that it was likely to be in the form of an injection. And that was nearly 12 months ago. And from that point on, it was clear, it was predictable that we were going to need to vaccinate more than 8 million Virginians in a very short period of time. It was predictable that there would be a supply constraint in the beginning. We didn't need computer models or simulations to tell us any of this. We knew that there was a pandemic. We knew that there was a vaccine coming, and we knew that we were going to need to give it to people. And we knew that that meant we were going to need to set up a way for people to get information and to make appointments. Now, Governor Northam said this week that his team has been working on this problem since February, last February, and that's good. But, Madam Speaker, I can't help but wonder what on earth they've been doing with their time. When the vaccine first arrived in Virginia, our local health districts were left on their own. Now, as I have said before, these folks at the local health districts do great work for the regional task that they've been assigned. But they weren't prepared for this, and the governor didn't provide them with any of the tools that they needed to accomplish this rollout. Our health districts were left to put together their own forms and their own spreadsheets and their own other intake information. Other states were ready. They had a place for their citizens to get information and to sign up. Virginia didn't. And the result of that shortcoming should be clear to absolutely everyone in this body. I have no doubt that, like mine, your phones are ringing off the hook with people desperate to find information on where and how they can get the shot. Most of them will be happy to wait in line, assuming that they know where to get in line. And instead, we're dealing with rumors of who has vaccines and who doesn't. One of our offices ran a test yesterday. They tried to book a vaccine appointment for a constituent, and they were on hold for 2 hours until they finally reached a call center in Dallas. Now, that person couldn't answer the question, and they referred the staff back to the website that they had just come from, that same website that listed the number that they had just called as a source of information for people who don't have internet access. There's no transparency here. There's near panic, and all of it could have been avoided if the governor had just done his job. Now, Governor Northam announced this week that such a website was on the way, but it wasn't ready yet because they hadn't planned on needing it until February, he explained. Now, Madam Speaker, this is either negligence at best or flat out incompetence at worst. West Virginia has a system in place, as does Maryland, as does North Carolina, as does Tennessee. The need for this was as predictable as the sunrise, but now Virginians are left in the dark and are suffering because Virginia isn't ready. Now, Madam Speaker, Governor Northam owes an apology to every senior citizen, every cancer patient, every healthcare worker, and every child of elderly parents who have sat on hold for hours waiting for some kind of information, left messages with no response, or just spent hours online trying to find any scrap of information. Now, I hope that this new system that's coming works. I hope it solves these problems and that my office phone will stop ringing all day and night. I hope that the desperate people will find a way to get online and be able to get the answers that I just can't give them. Virginians have been poorly served by this administration, to put it mildly. I hope Governor Northam and his team will do better. Based on past performance, I am not optimistic. I certainly hope I'm wrong. Thank you, Madam Speaker.